let's go to the phones because somebody's called in. I assume it's one of our guests, but who knows? Let's find out. Good morning. You're on KSJE. Thank you so much for calling in this morning.
Good morning, Scott and Megan. This is Jeff Bourgeois. How are you all today?
Jeff Bourgeois, we are well, thank you. And belated happy birthdays to you, Jeff Bourgeois. You celebrated a birthday over the weekend. Facebook told me.
Yeah, I did. There's no secrets on Facebook.
There is no secret. No, there is not, sir. You're welcome. Yeah. But seriously, we do want to find out how things are going at the hospital. So because birthdays come and go, and your numbers are still high, right, this week?
Yeah, it's kind of a mixed bag of some same news from last week, but also some good news and encouraging news on the horizon. Just our census as of this morning, again, is very high, a total census of 141. And we have 73 positive COVID patients and another 9 patients under investigation. So a total of 82 respiratory patients that are either up on the fourth or fifth floor. And maybe as of earlier this morning at 6:30, we had several holding in the emergency department. And that's not an uncommon circumstance right now. The Albuquerque Journal had an article yesterday about the hold times in EDs across the state increasing as the inpatient units are full. So patient movement is more challenging than it typically is, and it's something that takes a lot of coordination on a good day.
Right. And Jeff Bourgeois, I just wanted to, pardon me for interrupting, but that number seems very high to me from the numbers you've been reporting in recent weeks. Am I remembering that incorrectly, or is that
No, that's
accurate?
Correct. We have more than we did last week, and last week more than the week before. And it's interesting, our hospitalization numbers are continuing to increase. However, hospitalizations statewide have started to trend down just a little bit over the past 4 to 5 days. So it appears our peak is going to trail the state's peak in terms of hospitalizations a little bit. We have seen a flattening off of our 14-day positivity rate. We are just under 24%, still very, very high, but we had peaked closer to 26, 27% a few weeks ago. And the last few days, it looks definitely like a plateau. So we're hopeful that trend continues, but still a very high positivity rate for the test we complete here at our hospital. Again, I want to caution listeners that that's not the countywide number. That's just the San Juan regional number. And obviously, we are testing a symptomatic sicker population, so we would expect our numbers to be high, but still much higher than our peak way back in May, which was only 16%. So a lot of very sick people out in our community still. Our COVID to Home program has a census of around 70, and that's where we're monitoring patients who are symptomatic, whether or not they have a positive diagnosis or not, and checking in with them frequently to help them stay well at home, and also give them advice on what to do should their condition deteriorate a little bit. On the good news front, though, the state last week reported its some numbers statewide in terms of that R effective rate, and that's the rate of spread of the disease. And anything below 1.0 would suggest that the rate of growth is decreasing. And so for our county, which is our region, which the state calls Cibola, McKinley, and San Juan County, we are now at 0.8 as of last week. And that is down significantly from 1.3 just the prior week. So from December 1st to December 8th, we went from 1.3 down to 0.8. And the statewide number is also 0.8 as of last week. So these reports get published every Tuesday. So we're hopeful we'll see some continued improvement both within our region and within the state on tomorrow's report. So that's encouraging. And then the vaccine, of course, is all over the news. We do anticipate receiving our first shipment here at San Juan Regional Medical Center this week. Exact delivery date is still pending, but we hope to begin vaccinating employees as early as the end of this week. And then we'll receive a subsequent shipment, I believe, the next week if plans haven't changed yet. So, there's a light at the end of the tunnel. And of course, these first rounds are for healthcare workers and at-risk personnel, particularly at senior living centers, and then eventually move into widespread community vaccination that will hopefully create the type of herd immunity, is what they call it, herd immunity, to really get this pandemic behind us.
That's actually astonishingly good news, I think, both of those things. And also, if the state rate is trending down and we're trailing sort of in that respect, does that mean
hospitalization rate?
Yes, that's what I meant. Hospitalization rate is trending down statewide. So does that mean that we would have the ability to, if we were meeting our capacity, transfer those folks out to other parts of the state?
Yes, it does, Megan. And we again work with a central command transfer center that is being run out of University of New Mexico Hospital, and its sole purpose is for adult ICU transfers, both COVID and non-COVID, and it helps level load the ICU census across the state's major hospitals, and that's working exceptionally well. The hospitalizations are still right at 900 or so, so it's still very, very heavy. That's almost 3 times what it was at the peak back in May. So, while hospitals statewide are coming down, ours are still trending up a little. But the hospitals in Albuquerque and Santa Fe are still very busy and very full, also.
Very good. And Jeff Bourgeois, I wanted to go back and talk a little bit about the vaccines, because you mentioned that herd immunity number, and that's a certain percentage of the population that then now either has the vaccine or the antibodies, right, to fight off this infection. And so it takes a certain percentage of the population to have that in order to get us to herd immunity. And even if folks choose not to take the vaccine, that could impact that amount as we get closer to herd immunity, or delay that herd immunity if folks aren't all going to take the vaccine if it's available to them.
Right. We want to encourage people when they have the opportunity. Of course, it's an individual decision. You need to make your own individual decisions, but we encourage you to get vaccinated. And what we understand from the Pfizer and Moderna vaccines, which are going to be the first and second to hit the market, is that their research and development and trial process was not shortcutted and very thorough. And with the FDA looking at this just last Thursday and Friday, it was felt to be safe to release this to the general public. So I've got to trust that those systems work well and that this vaccine is safe, and I am certainly going to want to take it for myself as soon as the opportunity is presented to me.
Yeah, very good. Well, Jeff Bourgeois, thank you again for joining us. We're going to take a 2-week break here coming up, but we will catch you in 2021, actually, and hopefully the news will still be trending in the good direction.
Well, I hope so, and wishing you all just a blessed Merry Christmas and let's have a COVID-free 2021.
I agree. Hear, hear. Thank you, Jeff Bourgeois.